Welcome back to Health Insurance Unraveled. As always, my name is Travis Stallman. I'm a licensed health insurance broker based out of Wisconsin. I service pretty much all the counties in the state of Wisconsin, as well as I answer general questions from individuals throughout the country. So if you're watching this in Wyoming, Texas, Arkansas, feel free to reach out if you do have any questions, specific topics you'd like me to cover in a later video. It has been a little bit of time since I last recorded, as I've been redoing the office here. So hopefully now we can get back on track and every Monday be on the lookout for a new Health Insurance Unraveled video. Today we are going to focus on Medicare Special Election Periods. SEPs, sometimes they're called Medicare Special Enrollment Periods. An enrollment period or an election period means that you have the availability to switch your policy, enroll into a new policy, or disenroll from your current policy. Typically, you hear the Joe Namath commercials in October through December during the annual enrollment period, and then January through March, you have the open enrollment period for those on Medicare Advantage and prescription drug policies. Today, we're going to focus on the middle of the year. What happens if, my doctor leaves the network and I don't like the new doctor? What if I need to go see a specialist and this specialist isn't covered under my policy and now we're in June, July? Well, the good news for you is there are what's known as special election periods. Special election periods give you the availability as a Medicare beneficiary with life-changing circumstances to switch your insurance policy from one policy to another, or to disenroll from your current policy and potentially just go back to original Medicare. There are some common special election periods out there that I'm going to touch base on, and then some less common ones. So the most common one is going to be change in residence. Let's say you move. I don't care if you move across the street, down the road, or across the state, or let's say you move into a new state from your previous state. Anytime that you relocate, I always tell my clients and anybody who has insurance, I don't care if it's Marketplace, Medicaid, uh, Medicare, if it's employer group coverage, let your insurance broker, your HR representative, let your insurance company know, hey, I moved. Just because the policy may be available in your new service area doesn't mean that it's going to be under the same contract code of your previous service area. Therefore, you may be eligible for what's known as a special election period to check other policies, either with the same carrier or explore other carriers in your new service area. So change in residence, once again, I don't care if you move across the street, down the road, across town, or across the country. Just let your insurance agent, insurance broker, HR department, if you're employed, let them know, hey, I need to update my address. As well as if you have Medicare and you do relocate, make sure that you update your address with Social Security as well. That's a common mistake that a lot of people make. I always tell people contact Social Security first, make sure that they have your updated address on file, and then give your broker or agent a call, because we need to make sure that they have the same address that we put on applications for you when you do an enrollment into an alternative policy. The second most common election period for special election period is, I'm retiring in the middle of the year. My spouse retired. I've been on their policy for 7 years, past 65. Now I'm 72. What do I do? Well, if you have employer coverage and you drop that employer coverage, typically your employer coverage will cover you to the last day of the month. Every employer is a little bit different, so double check with your HR department. But in most case scenarios, your employer coverage will cover you to the last day of the month. Then your Medicare will start the first of the following month. That is when your Medicare Part B may start if you had Part A at 65 and now you're 72 in this hypothetical. As well as, let's say your employer coverage offers you some type of subsidy if you stay with the employer group policy under a Medicare policy. So reach out to your HR department. This way you're not subject to any type of penalties. You're going to get the most benefits, that you're eligible for yourself, your dependents, if you have any under that employer group policy. So loss of employer group coverage is a special election period. If you move from your service area, that's a special election period. Another very common special election period is, let's say you have some type of chronic condition. Let's say you're diabetic or you have congestive heart failure. That may make you eligible for what's known as a chronic special needs policy. So those policies are specifically designed to add in additional benefits to help reduce down costs for insulins. They may help reduce down costs for certain medical procedures. So if you do have some type of chronic condition, if you are diabetic, if you have some type of chronic special need, reach out to your broker, reach out to your agent, your insurance carrier, or myself, whoever it may be that you trust your insurance needs to, because you may be eligible for a special election period if you're unsatisfied with your current policy. In the final special election period, especially here in the state of Wisconsin, right now is if, let's say, you don't like the policy you're in, there might be what's known as a FEMA special election period. So FEMA is a government program that's out there, and here is the definition of FEMA. If, let's say, you had an election period in the past 3 months, you don't like the policy you're in, you may be eligible to use that FEMA election period to get into another policy. So even if you didn't move, even if you didn't leave an employer, even if you didn't drop group coverage, if you're not eligible for Medicaid, you may have that special election period through FEMA. So once again, just because we're in the middle of the year does not mean that you are not eligible for alternative policies out there. If you do not like what you have, if you do not like your monthly premium, if you're on a supplement and your supplement premium's going up in June or July of this year, you may be eligible for an alternative policy. If your doctors move, if you need a new doctor, if you need to go to a new facility for whatever reason, if your medication coverage isn't what you feel like it needs to be, reach out to myself, reach out to your broker, reach out to your agent, reach out to your customer service department. We are here for you. Answer any questions you have. As always, health insurance is a journey. It's okay to ask for questions. That's one of the taglines I always tell my clients. It's a journey. You never know what's gonna, what path is gonna lead you down which road and what's at the bottom of that hill. You can get to the top of the hill and everything looks great. And then as soon as you go down that hill, okay, well, at the top of the hill, I didn't have a broken leg. Now I'm at the bottom of the hill and I tripped and I fell and now I broke my leg and I have to go in for x-rays, CT scans. I have to have surgery. And now I have to go into rehab. How's my policy going to cover me? My policy doesn't cover me the way I feel like it should. Special election period may allow you to choose an alternative policy in the middle of the year. It's a journey. We are here to help you. It is okay to ask questions. My name is Travis Dahlman. I'm a licensed health insurance broker. Thank you for watching.